Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I'm talking to Dr. Kevin Michaels. He's the health officer here at Mobile County. So, Dr. Michaels, thank you for being on Wellness Wednesday.
Well, thank you for having me.
Well, there's been some latest developments here with the government and the Department of Government Efficiency, and you've already been speaking to some other outlets about how these things will be affecting or possibly affecting us here at the health department. So I'll just go ahead and ask you: is the health department being affected and facing some of these government efficiency cuts?
Yeah, we are, again, thank you for having me. We are faced with that. Because of the size of our health department, um, we can't compete for federal grants at the federal level. And so we're dependent upon ADPH to represent us and gather, apply for those grants. And so over the last couple of weeks, as the new federal administration comes in and they start putting their leadership into place, there have been a lot of executive orders that have impacted how we can provide services. And some of them have turned around and the executive order went in place, legal objections went in place, and it's sort of a stop and go with funding. And that's typically where we see on the family health side of the house. Now, more recently, we have known that the COVID funding was going to eventually end in 2026, and they've been extending that money a long time, a long period of time. And so if you look at how we've been funded as a health department since about the 1980s, the legislators set a set amount to be allocated towards public health services. And our organization, since probably the late 70s, has been focusing on providing primary care to the uninsured, underinsured, the indigent population. And we've been focusing on that. And we've been competing for money in that, and we've expanded our services for primary care, whereas the public health component of investment has probably stayed flat over the last couple of decades. And it wasn't until the start of the COVID that all of a sudden there was a plus up of money that was brought to the health departments. And our story is probably not any different than any other health departments
Mhm.
across the United States. The investment's sort of been a flat line. There have been times where we got a little bit more money and times it kind of dropped down. And so that COVID money gave us the opportunity to um, improve our infrastructure by renovation of buildings that we've been putting off until we had the money, improving some of our software is, the finance software, the HR software. So we've used the money that we got from COVID to invest in the infrastructure, but we also had to plus up of people. We brought a lot of people on board early on, in 2020. And we knew the money was going to end. And so when I came on board, I said, hey, we need to start planning for this. And so we went through a lot of recognizing positions and shifting from 100% COVID funding, shifting them more so into other positions where we had a secured funding, but we still continued that COVID funding. And what occurred last week was sudden. No one really could have appreciated it. It was an immediate stoppage of funding. And we had been focusing over the last couple of years of where
Mhm.
we're going to get as an organization post COVID funding. And if you look at one of our objectives in our strategic plan is post COVID funding. How do we keep the health department going after the funding? We thought we had some time until 2026 with some of the money, but effective 24 March, it all stopped.
Mhm.
And then that caused the urgency or that chaos that we had to look at taking care of our people, because our people are really important.
Mhm.
Taking care of our people and making sure we get them aligned in areas, but also at the same time, look at our mission that we need to provide public health services to the community. So we want to preserve all that. So that's been the challenge. And,
Mhm.
and looking at how much federal, all health departments depend on federal money. And when the money was stopped, that's caused the scramble from ADPH down to the local health departments, including Mobile County Health Department.
So, what, and also too, what you were saying was, we were already bracing for impacts and putting things in place
We
because
thought we had the time.
right, we were anticipatory about it, and the time is here. The time is now. Um, so, you talked about some, funding, from ADPH down for different departments. So, how much of federal funding makes up the health department's budget?
I'm going to say approximately half.
Okay.
And not all of that money has stopped. We knew that the health equity funding, the COVID funding, the ELC funding was going to end. And so it's not, and all that federal funding, it, it it wasn't the total, it wasn't all federal funding stopped. Certain pieces, a proportion of it was slowing down that we knew was going to happen, but that abrupt cessation, 24 March, kind of hit everybody off. And then the question is the public health infrastructure grants from the federal government. And so there's a lot of uncertainty or unknowns on whether the public health infrastructure grant is going to be there in totality, and it's matching up the uncertainty. We're in an uncertain time right now, but the key is we have to promote, protect, and enhance the health and well-being of our community. And so that's the
Mhm.
challenge that myself, Paul Betros, um, Kelly Warren and Stephanie Woods Crawford, we're working those issues, talking with finance, HR to make sure that we have the money for the future, and we also are able to maintain the workforce.
I know it's a
So,
little premature to kind of anticipate. You never know what's going to happen, but is there anything that you see almost immediately directing, impacting, us being able to provide certain services, or is it just something that it's a day to day or a week to week thing?
well, we know that under EP, emergency preparedness, that we have a warehouse with a large amount of supplies and equipment for the community. That warehouse, the lease was being paid through one of the grants that were discontinued. So we have to get out of that warehouse like yesterday, like
Hmm.
last week. And it's going to take a little bit of time. So there are those costs that we have to shift and find other dollars to cover down on that. But we do need to recognize that that's a big moving piece. There were employees that were 100% funded, and a significant amount of their salary was covered. So we're shifting, we're doing our best to shift those employees into positions where we can cover with another grant or cover with other dollars. But then, unfortunately, there were some services and personnel that
Hmm.
it was we knew it was going to we knew in time that that position was going to go away.
Hmm.
And so it was moved up forward. And so, that's the hard part. I mean, there are people involved, but it's not just, I know everybody, it's Mobile County Health Department, but it's not just our health department. It is across the state, it's across the nation that we're all reacting to this. And, and the difference between public health, or public health works at the community level, while healthcare workers work at the individual level. Doctors and nurses, our family health focus at the individual level, but the rest of the organization focus at the community level. And
Hmm.
and you really the goal that we want to have is to make sure that everybody, our community, is as healthy and safe as possible. And that's how we need to allocate our dollars to meet those needs.
I think you pretty much covered, things, and you said you were very anticipatory. We knew that we had a plan in place. Is there anything else that you'd want to share with the community, or add to the things that you've already mentioned previously?
Well, it's going to be a challenge, but the health department has the resiliency to step up and adjust. I mean, we've always applied for grants, and we know that those grants will come to an end at some point, or those grants, the funders, their priorities may change, and this is what we're faced with. It's a larger amount. Our The priorities of our funders have changed, but our mission hasn't. We still have to be we still have to be present in the community to make sure that people are getting to the potential of being as healthy as possible and as safe as possible. And we work in the shadows, and unfortunately we may have to continue to work in the shadows. The flip side of it, when we talk about um, health equity and many of our outreach programs have gone out and partnered with, established very strong relationships with community leaders that may have been neglected through time, through our experience. And they've created those partnerships. Unfortunately, we may not be out there, but we need to find a way. And we know what, I mean, we will we have to maintain those relationships that we established during the early stages of COVID
Mhm.
to get vaccines to areas in our county that may have some hesitancy. And those relationships that we establish are really important, and we have to recognize that. And as we move forward, I think I'm going to digress a little bit, but talk about the Public Health Accreditation Board process, FAB. Everybody should know that, or should be familiar with that. Well, the FAB is going through and documenting what are your policies to maintain, public health in the community.
Mhm.
And this is just another emphasis of importance on what FAB is doing for us. We're establishing those processes. We may not have the people in the near term, but the program and those relationships we develop still need to be captured in the FAB process, so that when the funding changes, the priority changes, and maybe we have more money to reach back out into the communities again,
Mhm.
we know how to do it. We know who the people are. Um, just because today we had them yesterday, today they're not here, um, we may get them tomorrow. And when I say the people are not here today, we have also used in our HR process, moving people to key positions that we had funding for, allowing people to retire or and not necessarily replace them immediately. This was all part of our strategy to kind of get us through the next year and a half.
Mhm.
However, 24 March, it stopped. That's sort of that's been unheard of, from unexpectedly.
Mhm.
So, but our activities have helped us through that. So, thank you. I mean, I really want to thank the Mobile County Health Department, everybody, the diversity of people we have and different skill sets. I want to thank them for the support they have done, and I really do appreciate them. And we want to have a strong health department, a resilient health department to meet the needs of our community in the future, no matter what we may be faced with. So, thank you.
Well, thank you, Dr. Michaels, for that update and just kind of giving the community a brief picture of what's going on. So, but thank you again for being here on Wellness Wednesday and speaking about the Department of Government Efficiency.